Well, Dr. Richard Busch of the Busch Chiropractic Center joins us for this week's Medical Minute. And this week we're focusing on something familiar to a lot of people, headaches and neck pain. It is one of the areas that your DRS protocol can address. First of all, Doctor, good to see you.
Pleasure to see you as well.
Tell us how the two can be connected.
Well, one of the types of headaches that we work with is something called a cervicogenic headache. And very simply, that means a headache that's origin is in the neck. We have 7 cervical vertebrae, and in between each of those bones, we have little nerves that come out. They go down to the muscles in our arms and our hands, the skin on top of our body, and even the organs inside of our body. But they also go to the head. And so there are times where it can be as a result of something like a degenerative disc, which we've talked about as far as the DRS program, or a herniated disc, or even what's called facet syndrome, where the joints on the backside of the spine aren't moving correctly, and that causes an irritation to those nerves that can cause headaches. Something else is even like a whiplash accident.
Anything that kind of sets off, like someone at home, like, you know what, this is something I really need to
Well, a lot of times it can be movement oriented. Okay, so when we turn our head back and forth, and then all of a sudden we end up with a little bit of a headache. Also, along with that, sitting in front of a computer, we all have a tendency to do that, and everybody's
Right.
familiar with the texting neck now, where you're looking down all the time
Yep.
at your smartphone. Well, those are types of things that can over time cause it, especially if we have a functional problem where the joints in the spine aren't moving correctly. That can actually cause a lot of irritation to those nerves and incidentally cause headaches.
So if someone comes to you, what will you how you proceed?
The first thing that's most important with anything is always a case history. So we want to find out exactly what causes the problem or where the whole thing started. And then along with that, after we're done with the case history, we're going to perform a complete physical evaluation, whether it's neurologic and chiropractic. So we can determine, first of all, how everything is moving, but secondly, if there is a problem in their neck that is causing those headaches, what actually it is. And then we're probably going to have either some x-rays or MRIs done, if the MRIs are necessary, so we can actually determine exactly what's going on with that patient so we can make sure we're giving them the right type of treatment.
Boy, it's got to be quite a relief if not to joke, but a pain in the neck that's causing a headache.
Well, the thing is, many people have headaches on a very regular basis. And as a society, we've gotten all conditioned to the point that if you have a problem, you're going to take a medication for it. The only problem is that medication is never going to correct exactly what it was that actually caused the problem. And that's one of the things that we do in my office. We actually determine what the problem is and then what the proper treatment is so we can actually help that patient get the care that they need and get out of pain. And what's amazing to me is to see the changes in patients, not only in the way that they feel, but in their own interpersonal reactions with people. We kind of give them their life back.
Right, absolutely. Well, it's fascinating to hear that. And Doctor, we appreciate you coming in and talking to us about that. You can find out much more about the Busch Chiropractic Center. Just go to the website or call the number there on your screen. Right now, Alyssa will send it back to you.